Hypnotherapy alters the origin of problems in a way that allows patients to recover more wholly. Conventional medicine treats symptoms but rarely gets to the cause. Because the cause remains, other symptoms emerge to take the place of those that are successfully treated. The cause is, in essence, a dependency manifested in the symptoms it creates. Conventional medicine too often treats dependencies, making a drug or other treatment a placeholder for the disease. Since there is no real cure, you find yourself in a perpetual state of recovery, with no real hope for healing. Because hypnotherapy goes directly to the cause to promote healing, you not only get better, but you bypass recovering to a state of being wholly recovered. From that perspective, hypnotherapy does not fit the allopathic model in any way. It does not treat symptoms. It is not a do-for modality, as in the traditional doctor-patient contract. Rather, it is a do-along-with therapy because the goal of the hypnotherapist is to help you help yourself. It expands your scope for self-care. Complementary medicine consists of modalities that assist the modern medical doctor. Hypnotherapy is more than complementary. Rather, in many instances, it is an effective alternative. That would seem to be a bold statement, and it makes some people uncomfortable. But I'm not suggesting that anyone stops seeing their primary care physician. There are many things they do well for which they are specifically trained, but there are also some things that hypnotherapy does better. In other words, hypnotherapy will never completely replace the services of medical doctors, but it has the potential to help many patients take care of themselves in ways that reduce their dependency on doctors. You have a choice in determining how you maintain your state of health. There are many conditions for which hypnotherapy is a more effective mode of treatment than medical science. Clearly, I would not suggest you avoid seeing a doctor if you experience an acute injury, like a broken leg, or sudden illness. And if your day-to-day existence is dependent on pills and machines, it's unwise to drop them just to seek help through hypnotherapy. Understanding the possibilities and limitations of both hypnotherapy and medical science will help you make decisions appropriate to your needs. Either way, you choose to take care of yourself or you don't. A broken leg will not heal well if you ignore the doctor's advice to keep weight off it and avoid further trauma. A broken spirit will not heal well if you ignore the hypnotherapist's advice to adopt new behaviors and practice new forms of communication. I repeat, hypnotherapy requires that you take responsibility for your own healing. It is a viable healing option for all who dare. It makes you responsive to helping your body heal. It is simple, but you must engage wholeheartedly and trust the process. Half-hearted efforts brings about minimal results.